Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show. Today, bringing another really fascinating guest involved in creating a better and healthier tomorrow. Today, we are continuing, as we say, our virtual road trip around the world. We are going over to Egypt to speak with His Excellency Dr. Ahmed El-Sobky, who is chairman of the Egypt Healthcare Authority and an extremely prominent figure, esteemed for his leadership and expertise across both the clinical and managerial domains. As the chairman of the Egypt Healthcare Authority since 2020, he has founded the guiding principles of the organization, led for various transformative measures that we'll be talking about to enhance healthcare services and accessibility nationwide. Dr. El-Sobky's contributions extend globally, not only as the chairman of the HA, but also as member of the Universal Healthcare 2030 Steering Committee, governing council member in the International Hospital Federation, as well as at the Ministry of Health and Population. They're supervising critical projects like the Haya Karima projects, which we'll be talking about, as well as the Universal Health Insurance Project, leveraging various insights to drive impactful change. Dr. El-Sobky's career in health strategic management started in 2015. He was the youngest assistant, then deputy minister of health and population for monitoring and follow-up affairs, underscoring his dedication ultimately to advancing public health both locally and globally. Fascinating academic journey. Dr. El-Sobky has a PhD in diagnostic radiology from Menoufia University, did a master's in science and clinical service operations at Harvard Medical School, and also an executive diploma in public-private partnership healthcare, Frankfurt School of Finance and Management, as well as an MBA in business administration and management from ESL SCA. And Dr. El-Sobky also chairs the Scientific Council of the Egyptian Board of Healthcare Management, a position that he has held since 2021. A lot of very important topics to get into today on the public health front. Honored to have him with us. His Excellency Dr. Ahmed El-Sobky, thank you so much for taking the time to come on the show.
Thank you so much, Dr. Ira, for inviting me for this very valuable and very prestigious podcast. Thank you so much. It's my honor to join you.
It's wonderful having you. Would very much like to start off, as we typically do, by handing things over to you for a little bit, just to talk a little bit more about you. Would love to hear a little bit more about your background, everything from where you grew up to what started you on a journey and your interest in public health.
I think from your introduction, I think you already said everything about me. So thank you so much for that. But actually, my role now is chairman of Egypt Healthcare Authority. And also I'm wearing another hat for leading the transformation of the healthcare system towards universal health insurance as the director of, or the supervisor of the project of universal health insurance in Egypt, and also Decent Life campaign or presidential initiative, which is also a very important initiative. And I think we can talk about this initiative in this interview. Actually, I started my career as GB, like any doctor in Egypt, in primary healthcare units and centers in one of the rural areas in governorate, far away from the capital, from Cairo. It's called Menoufia governorate. And actually, this at that time, I think a lot of experience regarding dealing with patients in rural areas. I already have a lot of experience to deal with those patients. After that, I also choose radio diagnosis to be my clinical specialty. As you said, I had the master degree of radio diagnosis and also the PhD or medical directorate in radio diagnosis from my university in Egypt, Menoufia University. And after that, I shifted my career from being clinician and physician towards the management career. And I decided to have MBA as a start for this. And after that, my master degree in clinical service operation from Harvard University, and also in finance and management from Frankfurt School of Finance and Management in Germany. Also my MBA from French in Cairo. So I had the privilege to have a lot of experience, French, American, and German. That's why I think all of this experience and all of this knowledge can emphasize my role to lead the transformation of the healthcare system in Egypt.
Outstanding, outstanding. And yeah, I was very intrigued in reading about your dissertation, which had to do with Doppler ultrasound and evaluating these arteriovenous fistula failures. And I found it quite interesting because it is not just a dissertation about science and technology and ultrasound and sort of the clinical side, but a lot about what we're going to be talking about in a little bit in terms of cost-effective care and understanding that when we in your next role is monitoring and follow-up affairs. If we don't monitor appropriately and things go wrong, as in the case, these failures are very expensive. I wonder if you could talk a little bit about this work, because I think it's very important in laying the where we're going to be going in the discussion.
So actually, you know that Egypt is one of the populous countries in the MENA region, maybe the first populous country in the MENA region and Africa. So actually, we are suffering from a lot of burdens. And back to the hemodialysis and back to the renal impairment disease, actually, we have like 70,000 patients suffering from renal impairment. And in Egypt, we offer like 10 million hemodialysis session per year. It's like big number compared to the other countries in the same region. And that's why I decided in my thesis to deal with this problem, to make my thesis related to this very important disease. And as radio diagnosis and in Egypt, I decided to make sure that I will make my research in a very cheap diagnostic tool, and in the same time, very effective to diagnose and to anticipate the complication of this disease. As you know, all the hemodialysis patients need the vascular access for hemodialysis sessions. And actually, a lot of those patients develop complications from the operation and post-operation of hemodialysis of the vascular access surgery. That's why I used the technique of Doppler ultrasound to anticipate and to early diagnose of the complications which could be developed after the vascular access surgery. Actually, my thesis revealed that 43% of the patients could develop complications like stenosis, like thrombosis, and also pseudoaneurysms. That's why with this tool, it's a cheap tool compared to the CT and MRI and the other tools, we can also early diagnose those patients and deal with this complication early, and also make the vascular access as long time as we can. Actually, this tool is very effective, and my research, and after my research, we implement some results from my research in my hospital at that time, and it was very effective to improve the quality of the quality and outcomes, clinical outcomes of the patients, and at the same time to save money and to be effective using the resources of our hospital at that time. And in Egypt Healthcare Authority, actually, we adopted the same strategy, the same mindset. So all the decisions made in Egypt Healthcare Authority now are based on science, are based on best practice and literature. That's why I can claim that 90 or 80% of our decisions maybe on track, maybe right decisions.
As a follow-up to that, a couple of years later in 2018 at the New Library of Alexandria, there was a conference, international conference on big data analytics, and the title was Bridging the Gap Between Theory and Practice. You give a presentation entitled Big Data Implications at the Ministry of Health and Population. And it's a fascinating presentation that's available online. And in this document, you basically outline what we're going to be talking about in terms of transforming healthcare in Egypt. You go into everything from the importance of digitalization in better quality of care, lowering costs, preventing epidemic outbreaks, broad disease prevention. I wonder if you could talk about this presentation for a bit and a little bit of sort of just the themes that you saw in your own practice in terms of the importance of advancing digitalization, digital systems. And then in a little while, we'll get further into the broad story about transforming the healthcare system in Egypt.
I am astonished now to remember this presentation, and I will try to squeeze my mind to remember the context of the presentation because it's like 7 years ago. But anyway, I thank you so much for remembering me of this presentation. But the first thing came to my mind, that the impression of the audience. So at that time, 90% of the audience of the presentation, and as you said, the presentation was focusing on the big data analysis, the wearable devices, the virtual hospitals, and also using the technology and digital transformation for having better healthcare system. At that time, 90% of the audience said that it's like science fiction in Egypt. So to implement such a vision in Egypt with this portfolio of digital transformation, it's something like it's like a dream which cannot be real in the near future. So actually now in Egypt Healthcare Authority, we already overcome all of these challenges. At that time in 2018, actually, I can claim that 90% of the infrastructure for technology for the hospital and the primary healthcare units were not there, the infrastructure. And also we didn't have like software for hospital information system, primary healthcare information system, or even the platforms to connect the hospitals and the primary healthcare units in one system. So great challenges at that time, and that's why I believe that we already we have the vision, but we have a lot to do to implement this, to make this from a dream to a reality. Now, in Egypt Healthcare Authority, all the hospitals and the primary healthcare units under the umbrella of Egypt Healthcare Authority in 6 governorates out of 27, and we are acquiring more and more governorates, and our vision is to have all the Egyptian people and all the facilities in Egypt the same. So we have like 100% of our primary healthcare units are paperless now in Egypt as we speak now. And also the hospitals, 100% of the hospitals now in Egypt in the governorates of the implementation of universal health insurance. As I said, the 6 governorates are fully implementing technology and digital transformation. We have in Egypt now like 6 million electronic medical record, unified electronic medical record. And by the end of the implementation of universal health insurance, all the Egyptian people will have a health record and a unified medical number. And this, I think, it's a great achievement for Egypt in the context of the healthcare reform when it comes to the technology and digital transformation.
The next year in 2019, President Al-Sisi launches an initiative which you are the general supervisor of that is known as Haya, Karima, which translates in English as Decent Life, which is a really interesting program that sort of connects healthcare accessibility, community development, the principle of sustainable development. I was wondering if you could take a little time to talk about the history of this a rather transformative program, obviously your leadership of it. And then one of the things connected to it, I believe, was a really successful program in screening and treating and eliminating hepatitis C. I was wondering if also you could talk about the connection of that to the Haya Karima program.
Actually, you are right. So, His Excellency, the President in Egypt, President Abdel Fattah Al-Sisi, from day one put health and healthcare on the top of the political agenda, and that's why you can say clearly that Egypt transformed the position from being the first ranked country suffering from virus C to be the first country all over the world eliminating virus C.
Yeah.
I think in 1 year it's like a miracle. So actually eliminating of virus C and also screening all the Egyptian people against non-communicable diseases in the same campaign, it was another great achievement for healthcare and health from the holistic view of health. In the same time, President Abdel Fattah al-Sisi also launched the program for universal health insurance. And this program, as I said, is aiming to cover all the Egyptian people against all the diseases by 2030. And we already succeeded to implement this program in 6 governorates out of 27 governorates. And in the upcoming 2 years, we will cover like 5 governorates. So in the incoming or upcoming 2 years, we will have like 50% of our population under the umbrella of universal health insurance. And by 2030, we will cover all the population under the umbrella of universal health insurance. Not only universal health insurance, not only elimination of virus C and the screening of NCDs, Haya Karima. And Haya Karima, actually, it's like holistic approach, implementing all the goals of SDGs in the same time. So His Excellency started this presidential initiative and the presidential program aiming to access and aiming to improve lives of like 52 Egyptian citizens in the deprived areas, the underserved areas, in rural areas and remote areas. And this was like very important and at the same time very hard because the challenges related to the infrastructure, the challenges related to the sanitation, and also the health problems and health burden and the disease burden at or in this areas. Actually, now we succeeded to implement this mega project in like 30% of the Egyptian governorates, and we have like another two phases. Now we are in the second phase, and also by 2030 we will finish this program. And as I said, this program is not only tackling health, and the other social determinants of health, right, like education, yeah, and also housing, road safety, and water sanitation is very important pillar in this. Even workforce and how to prepare human resources for the environment of work in the private sector and in NGOs, it's also implemented and it's also included in this mega project. When it comes to health, because I'm responsible for the pillar of health in this major or this mega project, in health, actually, we succeeded to renovate and establish like 1,200 primary healthcare units, brand new primary healthcare units and center in this areas. And all of these primary healthcare units providing the primary healthcare services, all the primary healthcare services, preventive care and primary curative care, and also health promotion and health awareness. In the same time, we also established like 23 hospitals to take care of the secondary and tertiary healthcare services. Beside that, in the emergency, we established like 600 emergency center and ambulance center in those underserved areas. So we tackled all the pillars of and all the levels of health needs for the population in these areas, starting from the emergency, ambulance, and also the primary, secondary, tertiary care. in this areas also, we are providing now like 600 medical convoys. So we are working in parallel way. So providing healthcare services in the same time, development and establishment of new healthcare facilities. That's why it's like a very mega project. And I think after accomplish of this project, I think the ranking of Egypt in a lot of SDGs will be improved.
Excellent. Yeah, it's refreshing. Well, it's a very elegant program, and not just from the perspective of social determinants of health, but the fact that you're bringing in all, as you were mentioning, the potential to meet the SDGs, and then again for everyone listening, the hepatitis C paper can be found in the New England Journal of Medicine. Again, really amazing the amount of people that you were able to identify and treat early. So, a really important program. Let's, if you don't mind, Doctor, if we could just take a step aside for a moment, because we mentioned EHA, the Egypt Healthcare Authority, a few times. I was just wondering if we could, at this point, just reintroduce the organization that you're chairman of now, because it is this specifically that was, I believe, formed with the perspective of setting up the comprehensive health insurance system, UHIS. Could you give us a little bit of the history? Because I believe it was formed a couple of years prior to your taking the chairmanship. If you could take us through that history, that'd be great.
Yes. So actually, Egypt Healthcare Authority is one of the authorities newly established in the new healthcare system of Egypt. So before launching the universal health insurance as program in Egypt, before starting the journey of total transformation of the healthcare system in Egypt, we faced a lot of challenges. And at that time, I was involved as Deputy Minister of Health at that time. And I can frankly speak about all the challenges we were suffering from, especially the increased out-of-pocket expenditure, and also the infrastructure and the challenges related to the infrastructure and digital transformation. Actually, we didn't have the capabilities to have the digital transformation and using technology, and also patient satisfaction, which is very important. But at that time, the satisfaction surveys and the percentage of satisfied patients, it is not at the level we need. So at that time, His Excellency the President in 2018 led total transformation of the healthcare system in Egypt to deal with all these challenges in the same time. So the fruits of this transformation is to reorganize the health and healthcare environment in Egypt. So the role now of the Ministry of Health in the new version of the healthcare system in Egypt will be the regulation and oversighting the process of healthcare without interfering with or interfering in the healthcare provision, and also setting the policies and the strategies and take care of the preventive care and the emergency care. So this role will be the role of Ministry of Health in the new version. And beside the Ministry of Health, we have three authorities newly established. Egypt Healthcare Authority, which is responsible for acquiring the healthcare facilities from the Ministry of Health in the past and renovate all of these hospitals and the primary healthcare units, and then be the arm of the state in providing healthcare services. Universal Health Insurance Authority, which is very important authority responsible for the premium collection and healthcare financing of the healthcare services and the strategic purchasing of healthcare services from the private sector and also from Egypt Healthcare Authority as representative of the public sector and also NGOs. And the third one, which is very important, General Authority of Accreditation and Regulation. And this authority is directly reporting to His Excellency the President. Why I'm telling you that? Because it's responsible for ensuring the quality and patient safety in all hospitals and the primary healthcare units and the private sector facilities as well, to be aligned with the agenda of Egypt in related to the quality and patient safety and giving the accreditation to the healthcare facilities before joining universal health insurance system. So as you can see, total transformation when it comes to the governance model of healthcare, the role of the established entities and the authorities. It's totally brand new. My role here as chairman of Egypt Healthcare Authority is to lead my organization towards healthcare transformation in all pillars, starting from infrastructure, capacity building, and healthcare workforce training and improvement. For sure, digital transformation, because it's very important in decision making, as you know, and implementing the new trends of health and healthcare in clinical service operation and financial service operation, and ensure the financial sustainability of my organization, and also the hospitals and the primary healthcare units related to my organization. So, in a nutshell, Egypt Healthcare Authority is responsible for reshaping of healthcare system in Egypt and healthcare provision in Egypt.
And Doctor, as I mentioned it in your bio, one of your roles also is as Egypt's representative, UHC 2030 Steering Committee. I was wondering if you could just talk a little bit about that. And then just a couple of months ago, in October 2024, in The Lancet, you write a quite extensive piece entitled From Reform to Excellence, the Future of Healthcare in Egypt, where you outline a lot of what we've been talking about, and then a little forward view to 2032, I believe. Could you talk a little bit about this paper? And then one other thing I'll add to that, I noticed that you also recently presented the theme of the first connected healthcare system in Northern Africa at Healthcare Information Management Systems Society. I was just wondering, comparing to the 2018 meeting where people were looking at you like you were talking science fiction, what was the reception at the 2024 meeting?
Yes. So actually, it's very important to highlight this very important point. So as representative of Egypt in UHC 2030, and as you know, it's like movement for pushing the governments and also the member states towards implementing the commitment towards the goal number 3.8, which is concerning about universal health insurance. Yeah. So how to make this real, not only like a United Nations decree without real implementation on the ground. So UHC 2030 is very important tool of WHO, and a lot of representatives from everywhere representing the regions of WHO are engaged in this platform. And my role in this platform, not only to represent Egypt, but also to make sure that the middle income countries and the countries with the similar socioeconomic situations, what are the challenges we are facing, what are the solutions we are offering, and also what are the support we need from member states to push and to enhance our capabilities towards achieving universal health insurance. Actually, in this platform, also I'm advocating for the Arab League countries to ensure that they have maximum support from WHO and the United Nations, and also to make sure that all the voices from the Arab League are on the agenda. Why I'm telling you that? Because a lot of peoples and a lot of nations in Arab League need to be updated with the standards and updated with the decrees and the decisions made in the United Nations and the WHO. So UHC 2030 is very important, and I can say that my experience in this platform enriched my knowledge, and also the exchange of the expertise and lessons learned between countries from Europe, from Asia, from Africa. I think it's very important. So as one of the member state representatives, I think it's very important to have like this platform in not only in health, but in all sectors related to SDGs. And back to your question related to Lancet, because actually it's very important also to highlight and shed some lights on this valuable paper we already made in Egypt Healthcare Authority. Why I'm telling you that? Because again, in Egypt, we had a lot of the challenges and we have a lot of lessons learned from our experience in implementation of such mega project, which is universal health insurance. Why I'm telling you that? Because actually we are middle income country. We have a lot of challenges related to the huge number of population. We need a lot of efforts to overcome all of these challenges. But actually we succeeded. We succeeded to reform our healthcare system. And at the same time, we are heading now to the excellency of the operation, clinical service operation, and also the financial and non-clinical service operation. Also, I think this may be like a tool or platform to exchange or to offer our roadmap and our experience gained from our implementation in the six governorates, how we deal with all these challenges, how we make our resources in the right track, because we did a lot of efforts to be very effective and very efficient using our limited resources, and also how to change the culture. And this is one of the mega challenges we already faced in our journey. So to change the mindset of people toward this new system, very organized, and also to change the mindset of the healthcare providers, doctors, nurses, and also the technicians, all the healthcare workforce toward this new version of operation, using the technology, using the digital tools in diagnosis and also in treatment. I think it's not easy in a country like Egypt to do this, especially with the socio-economic challenges we already faced. At the end of the day, after the implementation and success of the first phase of the implementation, we decided to make this like paper for everyone, especially the leaders, the health leaders in socio-economic and the same socio-economic standard states and in the middle and low middle income countries. I think it's very valuable, and I invite from your platform my colleagues all over the world to make sure that they had this paper, and we also are ready for any questions or any inquiries from your platform regarding this paper.
And we will put a link to the Lancet paper in the show notes so everyone can directly access it. But it is extremely comprehensive, and again, I appreciate you taking the time to go through it. Doctor, I wanted to just ask you about a couple, what I'll put in the category of public health challenges that have been pretty important for our show. And I would love to just get your perspective. You're a very open, public-facing leader in the healthcare space, and I know you've talked about some of this in recent months. One of these topics is the threat of antimicrobial resistance, referred to many as sort of the silent pandemic, but it's not very silent. We know it's here. You've been active in the discussion about AMR, about One Health, surveillance, awareness campaigns, obviously the connection to the integrated healthcare systems that you're developing. Could you say a few words about the role of the Egypt Healthcare Authority in addressing this really growing challenge that's upon us?
So it's a great challenge not only for Egypt, as you know, for all countries, because as per the literature of WHO, now 1 million patient or 1 million death per year caused by the non-rationalized use of the antibiotics. And also, I think, as per also WHO, it will be like the first cause of death by 2050. So it's very risky and it's very dangerous issue. and we have to be very serious regarding dealing with this challenge. And in Egypt Healthcare Authority, we realized that not only to be aligned with One Health agenda and the trend of WHO to deal with this very important issue, but also back to the effectiveness and back to efficiency of using our resources. So if we give the permission for anyone to order the third line of quinolones of antibiotics, I think it's after that I will give the patient the most expensive antibiotics to deal with this after the resistance of the antibiotics. So again, it's against the efficiency, it's against the quality of clinical service operations. That's why in Egypt now we started to have and started to establish like center of excellence dealing with AMR. We also, with the assistance of WHO, we launched a program for the awareness for healthcare workforce to rationalize use of drug, to rationalize the ordering and dispensing of antibiotics for the fear of the antimicrobial resistance. And we were very successful in this program. And the fruits of this program is to decreasing the resources allocated for the antibiotics like 20%. And it's a huge number in the health system all over the world. And at the same time, the stewardship and the instructions of our leaders in the governorates is to rationalize the use of drug and to make sure that the authorized healthcare workforce, the consultants who are responsible for making sure that the ordering of the antibiotics are on the same track, are aligned with the guidelines and the protocols of the treatments. I think all of this emphasize the role of Egypt Healthcare Authority to lead the transformation of the drug dispensing and the medication, not only in our facilities, but also in the other facilities in the private sector and the NGOs. Why? Because we are very serious to tackle this global challenge.
And thank you for that. And one other challenge I'd like to just ask you about while we have you with us today: population aging. I took a look at some of the Egypt data. It seemed like in 2023, about 8.6% of your population was 60 or older. Estimated by 2050, about 14% of the Egyptian population. I know you've organized a higher committee for older persons to focus on this challenge. But can you talk about any interesting innovation programs per the EHA that are either in place or that you're developing to deal with this very important, I don't call it a burden, but these non-communicable diseases that it's not just the Egypt problem; it's everywhere. But would love to get your perspective from where you are now.
And so it's another big challenge. So your interview today is tackling the mega challenges which are facing the global context. So actually, aging also is one of the upcoming very important challenges in the healthcare system in Egypt. Because as you know, the paradigm of healthcare expenditure, so improving healthcare system will improve the life expectancy, and then you have to have more money because the aging population need a lot of care compared to the youth and categories of population. So in Egypt, as you know, we are a very populous country. We have like 110 million citizens in Egypt, and adding to our population, we have like 10 million migrants, and this very important number and very huge number compared to the other countries in our region as well. So with country like Egypt, we have to serve like 120 million humans. So I think it's very important to take care about the age group and the aging challenges. That's why we, as I said, His Excellency the President started to have a very proactive program for screening the population and the screening this age group against the non-communicable diseases. Why? Because we need to deal early with the complications and deal early with the early diagnosed patient to save more money in the future. And this campaign actually it was very successful. It's called or it was called at that time 100 million صحة or 100 million healthy lives campaign, presidential campaign, and actually we succeeded to screen like 70 million citizens in Egypt against the non-communicable diseases, and this screening was very useful to have also information and have also data about the disease burden, accurate data about the disease burden of this age group, and in the same time to make sure that we have all the preparation to deal with all those number of patients against the diseases we already diagnosed through this campaign. So to have health map, right, health map and very accurate health map, to have health needs very accurate as well. I think it is very important to deal with this very important and very risky challenge. In Egypt also, and in Egypt Healthcare Authority, we developed like programs for those age group, the home care, and also the outreach program to the elderly patients and also the disabled patients. I think it was very successful initiatives in Egypt Healthcare Authority. And with this initiatives, we already improved the health outcomes of those patients. And we are planning to give more care for this category of patient by establish very specialized unit for geriatrics and how to deal with the disease related to this age.
Yeah, I like the connection between obviously prevention and the non-communicable diseases, and obviously what you're doing with digitalization and your transformation work. So no, I appreciate that very much, especially with these trends that we see. Well, we just entered 2025. Would love to hear what's going to be happening in the coming months for you and your team. Any other healthcare transformation initiatives that we should know about while we have you today? And then I also know that you a couple of weeks ago you came back from the International Health Ministerial Summit in Rwanda. That was interestingly termed "Strengthening Health Systems for a Better Tomorrow." I love that title. Yeah. Any interesting learnings from other countries in the region that inspired you, that obviously you're probably teaching them a lot about for what's happening in Egypt, but any interesting insights from the summit?
Yeah, actually it was very interesting summit, as you said, and being in Africa, so you can also be exposed to very special types of challenges related to the Africa continent. And for sure, dealing with this challenges is very different. But at the end of the day, I think we have some very strategic lines to our vision towards the future. And as you said, it is not now option to have digital transformation and to focus on the virtual services is the era of the future and as the tools of the healthcare in the future. So in this summit, in my speech, I already emphasized the role of technology and role of telemedicine, role of the virtual services. And we have now in Egypt the first virtual hospital in Africa, in Egypt now in Ismailia. And it was a great achievement to Egypt to introduce such model for healthcare to serve the people in the underserved and deprived areas and in the remote areas with digital solutions, telemedicine, teleradiology, telepathology, tele-ICU. So all of these applications and all of these solutions in one side serving the big number of population in remote areas, I think it is one of the main pillars of the healthcare in the future. no one can deny that in the upcoming 5 years, the patient of the future and the healthcare facility in the future is totally different compared to 2025 for sure. And in setting our strategy, we are understand our capabilities now, and we start and end in our minds. So preparing our service to the digitalization and the AI, because it's another very important issue.
Mm-hmm.
I think it's mandate now. It's not now an option. And from my point of view, the wearable devices and the wearable devices technology and the medical the medical things will solve a lot of problems related to the capacity of the hospitals. So from my point of view, I can say that the hospital of the future will be like the operation theater and the ICU. So all the patients monitored in the inpatients, I think with the wearable devices, we can monitor them in their homes, not in the hospitals. And also the outpatient clinics will be served by the telemedicine. So I can access the patient through the telemedicine in his home as well. So all of this, all of these concepts and all of these lines should be considered in the planning for the healthcare in the future. Actually, it was very important to emphasize that, and also the robotic surgery. It was one of the pillars I highlighted in this conference, the role of the robotic surgery and how to push the tycoons producing the robotic surgery machines to make it affordable to countries in Africa. It's very important because we need, at the end of the day, not to leave anyone behind.
Right.
So the era of robotic surgery, it will overcome a lot of surgical interventions with better outcome, with better technology, with better care for our patients. So we need to involve the tycoons and the big companies producing these type of machines to make it affordable to all hospitals in low and the middle income countries for sure. Also, from my point of view, I can see that we can complement each other. So we can make center of excellence. I'm now talking about Africa. We can make center of excellence in cardiac surgeries in Egypt and complement this with neurosurgery center of excellence in South Africa. And we can communicate with each other, not to replicate, but to complement and to cooperate with each other as African countries. Why I'm telling you that? Because at the end of the day, in Africa, we have very limited resources. So we have one way to complement each other, to support each other, to make everything, starting from the vaccines and the medications, to localize the vaccine industry and medications industry inside the African continent. I think it's also very important. For sure, sustainability is another important pillar. And I can see that the Africa continent and the African countries now they have the full awareness of that sustainability and the green transformation, but they need more and more support from the international agencies and the funding agencies to support the movement and support the initiatives of some African agencies toward the sustainability and toward this green transformation in health and also in the pharmaceutical field.
I'm sitting here, not just enjoying listening to you, but thinking that we started we started an hour ago at 2015 and science fiction visions, and now we're talking about AI and robotics and vaccine manufacturing for everybody. It's been a really busy 10 years, but it's very impressive. I look forward to continue to follow the story. Any follow-up and final messages for our audience while we have you today, Doctor? Anything that I missed while we have you, please take the floor.
I'd like to thank you so much for inviting me for this platform and for this podcast. And I think my take home message that if we have a dream, uh, even not related to our capabilities now, we can do this with of the box insights and out of the box solutions. Only we need to focus on clear vision. Only we need to cooperate with each other to have the belief that we will achieve anything we need with this context. And at the same time, I think we have to cooperate with each other as countries because again, the lessons learned and the knowledge transfer is very important, especially in such mega projects like universal health coverage in some countries because it's like mega project. So with the cooperation with each other, with the cooperation with the international agencies and NGOs, I think we can do something different. My aim is to implement universal health insurance not only in my country but in all countries. My dream is to leave no one behind.
Excellent message. It's wonderful having you, Doctor. I wish you and your team the best with these programs as you continue to move them forward, to execute upon them. Again, for everybody that's going to be listening to this episode of our podcast across the various podcast networks or who'll be watching on the YouTube channel, again, you've been spending time with His Excellency Dr. Ahmed El-Sobky, Chairman, Egypt Healthcare Authority, doing amazing things to transform and reform the healthcare system in Egypt, apply those learnings globally. Doctor, again, I want to thank you for taking the time out of your schedule. Thank you for everything you do. And as we like to say here on our show, thanks for helping to create a better tomorrow via what you do. Really a great story.
Thank you so much.